Two things: my age, turning 65 last year, and my weight. I was about 285 pounds last year, and I wanted to work at least till I was 70.
Yeah.
Or as long as I could, and that was a lot of weight to be carrying.
Yeah.
I didn't feel big, but I knew it was a lot of weight.
Yeah.
And I saw the ad online,
Okay.
and it just made sense. I looked into it a little bit and got to check this out.
Mm-hmm.
So you had a special on there where you received some money off, and I called up, set up my first appointment, and a year later I've lost 50 pounds.
That's awesome.
Yeah, it's great, really
Good.
great. I've gone off 3 prescription medications.
Yeah.
No longer have high blood pressure,
Wow.
no longer have high cholesterol. Knee pain, arthritis went away. Yeah, coming here, taking the advice of Dr. Rose,
Mm-hmm.
and getting away from a lot of processed food.
Yeah.
Incredible what
Definitely.
those changes can make.
Yeah. It's pretty awesome. So did you go to your normal doctor before this, kind of trying to get help, and what happened?
I've been going to him for 40 years, yearly and then monthly for minor things.
Yeah.
And he could never take care of my migraines. I've been on thyroid medication for 40 years.
Yeah.
He could never fix that. Always felt weak and tired.
Mm-hmm.
That's one medication I'm still on, but instead of, I guess, pharmaceutical made, it's a natural,
Yeah.
which is much better for you.
Mm-hmm.
Anything you can get natural is going to be better.
Yeah. Sure.
Yeah, my doctor just covered up symptoms,
Mm-hmm.
so to speak. We're taking care of the issue.
Yeah. Totally.
And a lot of it's done through supplements,
Yeah.
which is crazy. I never knew that was possible.
Yeah.
Yeah.
That's pretty awesome. So 50 pounds, joints are hurting you. Like your job, I mean, is very active.
Oh,
Like,
yeah,
you use
very active.
Like, how has that changed things for you as far as like just your day-to-day life?
And not having to get a knee pad every time I get on my knees.
We'll do it.
I mean,
I'll bring it over
getting
here.
up and down, being a carpenter and all that. Just more energy
Yeah.
at the end of the day.
Mm-hmm.
Not tired all the time. That was my biggest complaint. I'm always tired.
Yeah.
I feel weak.
Mm-hmm.
And it's life changing. It's just incredible how seeing a doctor who cares and medicine that works.
Yeah. That's awesome. What was that first appointment like, sitting down with kind of Dr. Rose, and because I imagine it was a lot more testing than you've done in the past.
Yeah, the blood tests, I never knew they could do so many screenings and different things.
Mm-hmm.
It's just 4 or 5 files and 2 sheets of just numbers of blood tests coming back. Very thorough. I like the idea of the testosterone, how they check not just one number, but 2 or 3 different numbers. It's hard to explain, not being ready
Yeah.
to explain it, but yeah, just so the initial test was, and talking to Dr. Rose was just very exciting. I could tell exciting things were about to happen.
Yeah.
Just by the care I received here. I remember one day that I had called up and said I had some symptoms for something, and they said, yeah, that sounds like something you should take care of urgently, and go to the emergency.
Mm-hmm.
And I kind of waited, and they called me again the same day, saying, just letting you know that what you called about sounds very important. I said, I'm thinking about it, I really don't want to go. And they did it one more time the day after. And I had never had a doctor call me at home and tell me they were concerned about my issues.
Yeah.
And here it wasn't a doctor, but it was one of her nurses
Yeah.
who she instructed to.
Mm-hmm.
And I never saw care like that, someone who actually cared.
Yeah.
It's just, like, if it wasn't anything else, that would have sold me on this place.
Mm-hmm.
If someone actually really cares about how you're feeling and doing.
Yeah.
Yeah.
Yeah, the team here is awesome. I mean, everyone here is just so cares about the patient.
And so kind.
Yeah.
You're treated with respect, like you're a millionaire. It's like, this is great. This is so nice.
Yeah. Awesome. Anything else you feel like would be kind of important for people who are thinking about kind of stepping into functional medicine, or maybe they've gone to their normal doctor and they're just like, they know they can feel. I think that's a lot of patients. They go to the normal doctor and like, I know I can feel better, but their normal doctor isn't helping them out. Like, what would kind of your advice be to them?
If you're going to your regular doctor and he hasn't taken care of it in a few months, why are you going? Why are you still going there? You know, I mean, they might be giving you medications, but it's not usually for the issue, it's for covering up symptoms.
Yeah.
Where here you deal with the symptoms.
Yeah.
Yeah.
It's totally different.
Yeah, it is. My health, my mood. So many people say to me, "You seem like you've got so much energy. What happened?"
Yeah.
And I say, "Med Matrix," and they don't know what it is. And I try to explain to them, and when I tell them my insurance doesn't cover it, they get a little iffy. But it's cheaper than going to your doctor every 3 months and not taking care of it.
Sure. Yeah.
So you pay once or twice here, and it's done.
Yeah. Yeah. What's the value of your health too?
That's right.
I mean,
Absolutely.
kind of know the value to that.
I've been coming over a year now, a year and a couple months, and I spent a little bit, but it's nothing. You know, I would have spent some at my other doctor,
Yeah.
and would have been on medication, which is a monthly cost.
Yeah.
And here I'm just on supplements.
Yeah.
Yeah.
That's awesome.